Obviously, there's a huge spectrum, Dr. Proud, of patients who have very severe SMA and other patients who are living a normal life with minimal disability. Do you see the potential red flags in terms of decade of life that as Sebastian gets older that you may have other concerns of the effect of the diagnosis on medical issues that he may have in the future?
So we really don't necessarily see that this impacts kind of other organ systems in a different way than it would in somebody who is typically developing. It is incredibly important to make sure that our younger patients who will be surviving into their 60s, 70s, and 80s continue to seek routine medical care that's appropriate. That can be very difficult. It can be hard for some of our patients to be able to get onto an examination table to perform things that are recommended, like a colonoscopy, or women getting their yearly examinations. And so I really try to reinforce to my patients that as uncomfortable as it may be, you need to keep up with the routine standards of care, because my hope and expectation is that you will live a very long and fruitful and healthy life.
Obviously, Sebastian's now 22. Do you have questions about how to screen for your own children in the future and what tests need to be done? How do you broach those subjects when you have a patient with SMA who are asking about their own family?
We just talked about this in clinic.
I'm actually 23 too, but it's fine. The younger I am, I feel, I won't check my ID as much. But as far as we did actually just talk about this, we talked about that you would be able, whoever I decide to be a partner with, they'll be able to do the scanning there as well, and to see the potentials of the child having the baby as well. There's also research to where I believe that you said that they could see which eggs would actually have the SMA gene and the ones that don't have the SMA gene as well. So there's a lot of things in science now that are becoming very beneficial to people with SMA to try to move forward and have those families and be able to know how to take care of the child when the child does come into the world. So
would you be recommending genetic testing early on in
So
this situation?
The American College of Obstetrics and Gynecology now recommends that individuals be tested for carrier status. So we know that Sebastian is affected by spinal muscular atrophy, and so the next question is whether or not his partner would be impacted as well. And so we would then test that partner to say whether or not they were a carrier. If that individual was a carrier, we would know that there would be a risk to the future offspring, that they may be impacted by the disease itself versus being carriers themselves. And so we would approach that very differently. We do have a genetic counselor that I work with that is able to help us educate our individuals who are looking at family planning, or families who already have a patient or a child who is impacted by SMA and who might want more children in the future. And how do we go about that? There's options these days, which Sebastian was alluding to, with consideration of things like in vitro fertilization with pre-implantation genetic diagnosis called PGD that can identify embryos impacted by SMA and those that are not. So we have a whole world of things that need to be discussed when we're talking about family options.
Sebastian, we've heard that you have a phenomenal medical team around you and you've had access to novel therapies where it's actually a very proactive way that you got this infusion up front, where Dr. Proud reached out to you at college. Who else has helped you on your journey other than the medical profession?
My parents, they're awesome. They're very supportive. They kind of, especially my mom, she pushed me into it. Kind of, well, I just want to see you do one of those type of guilt into it things, but I'm glad she did, because if not, I probably would have been, like I mentioned earlier, worse off and still having trouble picking myself up off of the floor. I do still need assistance here and there, but I'm getting a lot stronger each day, and especially when I get my infusions, they're helping a lot, so I'm grateful.
And when you're with peers at college and friends, do they have an understanding of the effect of the disease, do you think, on your limitations, or does it not really come up in conversation?
They do. It's to the point of where if somebody's staring at me, that they're kind of they're defensive about it because they understand what's going on. Or they'll actually, I've educated the people around me enough to where they can educate somebody else. Because sometimes there's a side conversation when people are uncomfortable to come to the person.
Right.
So I've educated the people around me enough for them to be able to explain to somebody else, and then, oh, okay, I've never heard of that. So it's always good to get the information out there to everybody, even people that may not have heard of it or even know what it is.